special report on the alarming decline in care for those with inflammatory bowel disease. A survey shared with ITV News shows a big fall in the quality of help over the past 5 years. A survey of 17,000 patients by charity IBD UK found no service for the disease in the UK meets the standards for care or staffing. This leads to delays in treatment and diagnosis with sometimes very serious complications. 1 in 7 adults is only diagnosed once they make emergency hospital visits. And only 1 in 5 of those with IBD agree that they've been asked even about their mental health. Gary Davis heard from one patient who says nobody took her seriously until she was rushed into accident and emergency.
So I personally change my bag most days. Every day I have a shower. This is my stoma bag. I have a drainable bag.
Sophie Pearce has been living with her stoma and bag for 4 years. It's how her waste leaves her body. In 2020, she had her bowel removed after being diagnosed with ulcerative colitis. This daily ritual has given her a freedom she once thought impossible.
And we're done.
And it's life-changing.
Yeah. Absolutely life-changing. And you know, there could be so many comments on like, oh, your stoma's ugly or your stoma looks like this. It's like, does that really matter? Like, it saved my life.
Sophie suffered with debilitating symptoms for 14 years despite numerous GP and hospital visits. Eventually, growths called polyps were found in her bowel, but that didn't explain her condition.
I would say to my gastro consultant, like, I'm rectally bleeding like all the time. I've got diarrhea, urgency all the time. Stomach pain that has got me on my bathroom floor, like howling in pain. And multiple times he said to me, I'll just treat it topically for hemorrhoids.
One day she bled so heavily she had to be rushed to A&E, where she was sent straight to theatre.
The consultant that spoke to me as I came round from that said to me, this is the worst inflammatory bowel disease, ulcerative colitis, I have ever seen. I did get an apology from my gastro consultant. He did ring me and he just said, I'm so sorry, I was so focused on the polyps that I oversaw the bowel disease.
Surrey and Sussex Healthcare Trust has also apologised for Sophie's diagnosis experience and says patient access to testing has since improved. Inflammatory bowel disease is an umbrella term for immune disorders which attack the gut, causing inflammation. There are 2 most common forms. Crohn's can lead to inflammation and ulcers anywhere along the digestive system, while ulcerative colitis usually affects the rectum or colon. There is no cure, but medication and lifestyle changes can help manage it.
How have you been?
Good, how have you been?
Oh.
Much of Chloe Meadows' adult life has played out on reality TV in The Only Way is Essex. But for years she kept her inflammatory bowel disease to herself, going public ahead of running this year's London Marathon for Crohn's and Colitis UK.
I just want people to not be embarrassed and to normalise going to the toilet and your habits and how healthy they are if they're not, because, you know, it can save your life.
What's your experience of your treatment been like?
Initially, when I was first diagnosed, it was amazing. They were so great, and I had this nurse and she was sort of my designated nurse. And she knew me personally and my story, and so she was very good at sort of helping me. Whereas I think post-COVID, the NHS are obviously so overrun now that I'm kind of just put to different people each time.
And that change is reflected in a report shared exclusively with ITV News, which shows the standard of IBD care in the UK has declined in the past 5 years. St Mark's in London is considered one of the leading IBD centres, but around the country, only 1 in 5 services now have enough specialist nurses.
We want to be seeing people in a timely manner. We set ourselves very high standards to try and see people in a timely manner because we know that these conditions are really impactful on people's quality of lives. But unfortunately, there's just waiting lists that we have to deal with.
For singer-songwriter Tom Spate, accessing timely treatment has been a challenge. He's recently finished his 4th album, having learnt to manage living with Crohn's, but spent 2 months in hospital while making his first.
Once I got diagnosed, you think you're in a system of being cared for, but I really wasn't. Like, there wasn't there wasn't any aftercare. The NHS are an amazing thing when you're in a crisis, but when you're in this kind of like dull wake of having a chronic condition, it's really difficult to kind of keep up with everyone.
What are you doing?
Sophie is now doing all she can to make up for the 14 years she lost waiting for answers, and wants others to avoid the unnecessary suffering she endured.
It's a really fascinating report. But what did the Department of Health say about this?
Well, the department says that the government has inherited a broken NHS. It says that people suffering from inflammatory bowel disease aren't getting the care that they deserve. They insist they're going to change that. They say they've got a plan to improve diagnostic services. One of their promises is to invest £1.5 billion in new equipment. We've also heard from the NHS. A spokesperson there said that staff are diagnosing and treating more people with inflammatory bowel disease than ever before, but that demand means that they're trying their best to bring down wait times. Charity Crohn's and Colitis UK says that the 500,000 people suffering with IBD in the UK are currently being failed. They say that any improvements can't come soon enough.
OK, Carrie Davis, thank you.